You feel a headache coming on, and the first thought that pops into your head is my blood pressure must be high. A lot of people believe this. A pounding headache, pressure in the head, a heavy feeling behind the eyes, and immediately the assumption is that blood pressure is the cause. Friends say it, family members say it, sometimes even doctors mention it. But here's the surprising truth that most people don't know. Most headaches are not caused by high blood pressure. In fact, many neurologists point out that unless blood pressure reaches extremely dangerous levels, it usually doesn't cause headaches at all, which means that millions of people may be blaming the wrong thing for their pain. And this confusion around headaches is something neurologists have been discussing for decades. The legendary neurologist Dr. Oliver Sacks, known for his work studying migraines and the strange ways the brain processes pain, often emphasized how misunderstood headaches really are, both by patients and sometimes even by physicians. So what actually happens when blood pressure is high? When does it cause a headache? And when is the headache coming from something completely different? And more importantly, when is a headache a warning sign that something serious might be happening in your body? In this video, we're going to break down the science behind blood pressure headaches, explain when they actually occur, how they feel different from migraines or tension headaches, and the warning signs medical professionals say you should never ignore. This video is for educational and informational purposes only and is not a substitute for professional medical advice. Always consult your doctor or a qualified healthcare professional before making decisions about your health. And before we continue, if you find videos like this helpful, give this video a like and subscribe to Headache Relief Lab. Here we break down the science behind migraines, headaches, and chronic pain in a way that actually makes sense. Because understanding the difference between a normal headache and a blood pressure emergency can make all the difference. So let's start with the biggest myth of all. Let's start with the biggest misconceptions surrounding blood pressure and headaches. Most headaches are not caused by high blood pressure. That might sound surprising, especially because the connection between the two is repeated so often that many people take it as a fact. Someone gets a headache, checks their blood pressure, sees a slightly elevated number, and immediately assumes the two are connected. But according to many neurologists and cardiovascular specialists, mild or moderately elevated blood pressure usually doesn't produce symptoms at all. In fact, high blood pressure is often called the silent condition for exactly that reason. People can have it for years without feeling anything. So why do so many people believe their headaches come from blood pressure? Part of it comes from timing. When people feel pain, stress levels rise, the body releases adrenaline, and blood pressure temporarily increases. So someone checks their blood pressure while they have a headache, sees a higher number than usual, and assumes the blood pressure caused the pain, when in reality, the pain and stress may have caused the blood pressure spike. It's a classic cause and effect confusion. Now that's not to say blood pressure can never cause headaches. It can, but the circumstances are very specific and much more serious than what most people imagine. We're not talking about slightly elevated blood pressure. We're talking about dangerously high levels that put the brain and blood vessels under extreme stress. And when that happens, the headache behaves very differently. That's what we're going to talk about next. So if most headaches aren't caused by high blood pressure, when does blood pressure actually become the problem? The answer is something doctors call a hypertensive crisis. A hypertensive crisis happens when blood pressure rises to extremely high levels, typically around 180 over 120 or higher. At that point, the pressure inside your blood vessels becomes so intense that it can start damaging organs, including the brain. This is very different from the mild elevations many people see during stress or pain. We're talking about pressure levels that put enormous strain on the circulatory system. When blood pressure reaches those levels, several things can start happening inside the body. The blood vessels in the brain can become overwhelmed by the pressure. Fluid may begin leaking from tiny vessels into surrounding brain tissue. This can cause swelling, irritation of pain-sensitive structures around the brain, and a sudden severe headache. Doctors sometimes refer to this as hypertensive encephalopathy, a condition where extremely high blood pressure begins affecting brain function. And the headache that appears in this situation often has a very specific pattern. It's usually intense, persistent, and often described as a heavy pressure or throbbing pain, frequently located in the back of the head, especially in the morning. It may also come with other symptoms like nausea, blurred vision, confusion, chest pain, or shortness of breath. In other words, when blood pressure truly causes a headache, it rarely comes alone. The body is usually sending multiple warning signals at the same time. And that's why recognizing the difference between an ordinary headache and a potential blood pressure emergency is so important. Because the symptoms surrounding a hypertensive crisis are very different from what you would see in a typical migraine or tension headache. And understanding those differences can help you know when it's time to seek immediate medical attention. That's exactly what we're going to break down next. So what does a blood pressure headache actually feel like? Because this is where a lot of the confusion starts. Many people assume that any strong headache must be related to blood pressure, but the pattern is usually very different from other common types of headaches. A headache associated with dangerously high blood pressure often feels like a deep, intense pressure, usually located toward the back of the head. Some people describe it as a heavy, pounding sensation that seems to build steadily rather than coming in waves. Another detail that doctors often point out is timing. These headaches frequently appear in the morning, shortly after waking up. That's because blood pressure naturally fluctuates throughout the night, and in severe hypertension, those fluctuations can put additional stress on the blood vessels in the brain. But the most important difference is this: a true blood pressure headache rarely appears by itself. It often comes with other warning signs. People may experience blurred vision, dizziness, chest discomfort, shortness of breath, or a feeling of confusion or unusual fatigue. These symptoms can signal that the body is under significant cardiovascular stress. Now compare that with a migraine. Migraines usually come with light sensitivity, sound sensitivity, nausea, and throbbing pain, often on one side of the head. Physical activity tends to make migraines worse, and many people feel the need to lie down in a dark room. Tension headaches are different again. They usually feel like a tight band around the head, a dull pressure rather than a pulsating pain, and they tend to build slowly during periods of stress or muscle tension. So while all three involve head pain, the underlying mechanisms are very different. And this distinction matters, because treating a migraine, a tension headache, and a hypertensive emergency require completely different approaches. Which brings us to the most important part of this video, the warning signs medical professionals say you should never ignore. Let's go through them. So how do you know when a headache could actually be related to dangerously high blood pressure? Medical professionals often look for a combination of very severe headache and additional warning signs. It's rarely just the pain alone that raises concern. It's the pattern of symptoms happening together. One of the biggest warning signs is sudden severe headache accompanied by extremely high blood pressure readings, especially numbers around 180 over 120 or higher. At those levels, doctors consider it a hypertensive crisis, and it requires immediate medical evaluation. Another red flag is vision changes. People may experience blurred vision, flashing lights, or temporary loss of vision. This can happen when high blood pressure begins affecting the blood vessels in the eyes and brain. Chest pain or shortness of breath are also important warning signs. When these symptoms appear together with a severe headache, medical professionals often recommend seeking urgent care, because the cardiovascular system may be under significant strain. Changes in mental status are another signal. Confusion, unusual drowsiness, difficulty concentrating, or trouble speaking can indicate that the brain is being affected by the elevated pressure. And in more serious situations, symptoms such as weakness on one side of the body, difficulty walking, or loss of coordination may appear. These can overlap with symptoms seen in stroke, which is why they are considered medical emergencies. Now, it's important to remember that most headaches people experience are not related to these situations. Migraines, tension headaches, dehydration, lack of sleep, and stress are far more common causes. But when severe headache appears together with the kinds of symptoms we just discussed, medical professionals generally recommend not ignoring those signals and seeking prompt medical evaluation. Because when blood pressure reaches dangerous levels, early treatment can make a critical difference. So the real takeaway here is not to panic, but to understand the difference between common headaches and the rare situations where your body may be sending a more urgent message. Let's bring everything together. Many people automatically blame headaches on blood pressure. It's a belief that's been repeated for years. A pounding head must mean your blood pressure is high. But as we've seen, the reality is a little different. Most headaches are not caused by high blood pressure. In fact, mild or moderate hypertension usually doesn't produce symptoms at all, which is why doctors often call it the silent condition. When blood pressure does cause headaches, it typically happens during extremely high and dangerous levels, often alongside other symptoms like vision changes, confusion, chest pain, or shortness of breath. Those situations require immediate medical attention. For most people, though, headaches are far more likely to come from other causes: migraines, tension headaches, dehydration, stress, poor sleep, or even weather changes. Understanding the difference helps remove a lot of unnecessary fear, because knowledge changes the way we react to our symptoms. Instead of guessing or assuming the worst, you start recognizing patterns, triggers, and warning signs that actually matter. If this video helped clear up a common myth about headaches and blood pressure, give this video a like. It helps more people find this information. And if you're interested in understanding migraines, headaches, and chronic pain from a science-based perspective, subscribe to Headache Relief Lab. Every week, we break down complex neurological topics in a way that's clear, practical, and easy to understand. Now I'm curious about your experience. Have you ever had a headache and wondered if it was related to your blood pressure? Let me know in the comments below. I read them all. And as always, this video is for educational and informational purposes only, and is not a substitute for professional medical advice. If something doesn't feel right, consult your doctor or a qualified healthcare professional. Thanks for watching. Take care of yourselves, and I'll see you in the next video.